I think in mental health, one of the biggest challenges, at least as I see it, is that it's become too binary in terms of if you develop a condition, if you get them onto treatment very early in terms of biomedicine, their life will be set. And it's not as straightforward. Psychiatry is very young. And I don't think we have predictable outcomes as yet. But what is possible is good quality of life. So the Banyan is an organization that has been working for the last 30 plus years with the population of people who face homelessness and poverty along with mental health conditions. And our work essentially across the different interventions that we offer, whether it is residential care, inpatient services, or whether it's livelihoods, or housing in the community, whatever shape and form it takes, is essentially about engaging with people where they are and looking at supporting them so that they are able to live the kind of lives that they want to live. So in terms of creating and enabling pathways for them, so looking at quality of life, looking at dignity affirming care more than anything else, irrespective of where they may be on clinical terms. So that's the essence, I would think, in terms of the Banyan's work. If you look at the landscape of mental health care, whether it's globally or in India, of course, one can highlight different sorts of things one can talk about. But the reality of mental health care as it stands today is that one needs to understand that when you have a mental health condition and the way your life unfolds in this journey need not look the same for everybody, and it need not look necessarily like symptom reduction for everybody. It need not look like going to work in the typical ways for everybody, and that's the reality of it. So when you look at the sort of services that are available in India, predominantly for a low-income population now, somehow because of the sort of investments that we've been able to make, whether it's the government or in terms of civil society initiatives, they center around this paradigm of containment. So you look at people living in certain spaces, and or it goes into a paradigm of getting them into treatment very early and giving them medication. But what we have found in the Banyan, who are the people who come to us? There are people who come to us, they've gone to different treatment facilities, right? But they still end up homeless. So they've navigated all these different pathways and they've still ended up homeless. They've still come to the Banyan. So that's the reality of mental health care as it stands today in India. And the missing piece really is that one is too caught up in terms of, let's get this person, the person with mental illness, let's get this person very early on into treatment and medication. That itself doesn't solve the issue. People live in social and cultural worlds, and there are so many ways in which that affects how they progress in this journey of living with a mental health condition. So if I'm a woman and let's say I'm living in a house where I do all of the household chores, I take care of my children, I'm also responsible for earning for the household. So we have clients who every day get up early in the morning, get vegetables from the market, go out in the evening. We have clients who engage in small businesses of their own, take mopeds to 7-8 villages in the vicinity and sell it, earn money for their family. I do all of this. But what sticks in my social circle, especially when it comes to my immediate family sometimes, is the episode that I had after I gave birth, right? And they still see me as a person with a mental illness, and they still treat me that way, despite all of these other labors that I perform and the way that I stand up for my family. So it doesn't matter if this person has gone access to clinic, has been in an inpatient center. So many of our women come from circumstances like this because look at the world that they are living in. So I think in mental health, one of the biggest challenges, at least as I see it, is that it's become too binary in terms of if you develop a condition, if you get them onto treatment very early in terms of biomedicine, their life will be set. And it's not as straightforward. Psychiatry is very young. And I don't think we have predictable outcomes as yet. But what is possible is good quality of life, ensuring good quality of life, ensuring supports, ensuring that somebody is there for you no matter what for a lifetime, in terms of all the ups and downs that one may go through, can be assured. So one layer of substantive freedoms is, I would say, So it's ideal to say that we will remove systemic oppression, but what is possible is to build this person's internal resources and to make sure that there is a baseline level of dignity in terms of material conditions that they live in, right? So look at their material conditions, also consider in terms of building their internal resources. So one of the peer advocates that I was in conversation today, actually they made a very powerful statement. What she said is that the minute you find your voice to speak for yourself and stand up, you will see shifts in the community, not immediately, and even in the family, not immediately, but over a period of time. So maybe they look at me in certain ways today, but when I have stood for myself, when I have showed up for work, when I've showed up for my child, when I've showed up for myself, in every way that I want to every day, and that's because, and that strength also comes from within, then I see that, yes, they may start consulting me for small things, the community may invite me for events. So she spoke of stigma as not something that is static at one point of time, and it will keep fluctuating. But you need to be able to stand for yourself and be, as difficult as it may be, to draw from that inner strength. So I think one level of stigma is in terms of just building your own visibility and occupying the space that you're entitled to in society. So I think that's one aspect of stigma. And of course, the long-term pipeline dream is to completely remove the different oppressions that we see. That can we look at a world that perhaps is kinder and has more opportunities for everybody, irrespective of circumstances they come with. So how do we remove disparities more substantively? But that's a far away pipeline dream. And yeah, so those are the two ways. Yeah. So I think this was a very interesting experience because, and I'm also perhaps talking here more from a research point of view, because when we go and we engage with stories and we gather them and then we sort of, look at it together as a team and what does the story say and engage in that dialogue, it works a bit differently. What I really enjoyed with the stories that came through, and some of the stories I also know the people who are featured there, so I can, when I'm reading the stories, I can visualize them and listen and hear them in my head at least. So that was very interesting for me because it was written in a language that is perhaps, I wouldn't say simple, but I would say a language that feels like somebody is reading the story to you and you're in the center of those stories. So that was very interesting for me because it kept it in people's own words to the last, some of the stories, especially the one that is on caste and mental health, for instance, or the other story which perhaps looks at a very complex phenomena of mass suicide and a family engaged in it, but talks about the many other things that one typically doesn't look at when you see newspaper coverage on a phenomena like this. So it was interesting for me to actually hear the stories as they are, and it's a journey. So I feel like we need to embrace messiness and honest mistakes. So perhaps because we've all been in mental health sector for a very long time, we've engaged with people with mental health conditions. Some of us ourselves live with mental health conditions. So we perceive the language, the vocabulary in a certain way. We perceive representation in a certain way. That may not be the case for people from other professions. I would also see people from other professions who perhaps are also mental health service users themselves. But one needs to embrace the messiness of it and the honest mistakes. And what was very nice for me personally is this conversation that we kept having in terms of how does one, frame this? How do you want to look at this story? Is there something that we need to be sensitive about? So I got to speak to quite a few journalists in terms of how do they frame the story? How do they approach? What would be a good way to also start the conversation with certain people? I think one of the biggest takeaways from an issue like this that's focused on mental health, and that too in the context of freedom, is because mental health is actually at the core a justice issue. It's not just to do with health, it is largely to do with the social. Yes, it is health, yes, it is social, but it's also about justice. And I think when magazines, which a wide variety of people read from, and they come with their own experiences, and they engage with such content, it does foster a certain different kind of a dialogue, rather than, let's say, an academic journal doing it, or even if it was just pieces that, people do documentaries, people do small social media pieces. They generate conversations of a different kind than the sort of format where we're looking at, where we can get to stories in depth, in this kind of a written format. So I think it's significant because I feel like it brings it to center stage. It gives the opportunity to talk to a very diverse audience about mental health, not just in a very siloed treatment, theek ho jayega, that sort of a thing, but in terms of the so many different layers that one needs to peel. Yes, and feeling perhaps not sometimes alone. I would also say that even for people who are working in the sector itself, it's nice to see the large variety of stories that come up. One of the stories that was interesting for me to review and give feedback and work with the Outlook team was the story that was done in terms of caste and mental health, looking at the Dome community that engages in a specific profession. And why it was also interesting is because this is a story that needs to be told from the lens of how systemic oppression leads to people being in certain circumstances and what sort of mental health effects are there, not in terms of pathologizing their mental health conditions. I think the great thing about Outlook focusing on mental health in this specific issue is when one talks about mental health conditions in general, in a lot of ways, one could of course look at it as a disease, but it's in a lot of ways also people who resist social oppression, who break away from norms and build their own ways of living in some sense. I think the great thing about a dedicated issue on mental health and freedom, especially where we stand today in the world in terms of what the mental health landscape looks like, is that people are able to tell their stories, and it finds a voice in so many pages that many people across the length and breadth of India are going to read. And it takes stories to the drawing rooms of so many families. People will start having conversations, and it's told from the perspective of somebody who has faced mental health conditions from extremely oppressed circumstances, whether be it caste, be it gender, be it whatever it may be. And I think that's the great thing about this issue.